Okay, this is a question from Amy, and she says that she's a naturopath in New York, quite new to prescribing LDN. She had a few patients that have some different side effects. I was curious to if it's been seen in LDN and or other issues. I have one patient that has fibromyalgia and possible lupus. She has a significant improvement in her joint pain, sleeping, etc., and we're only at the 1.5 milligram dose. She can't tolerate much higher. At the 2.5 milligram dose, she started to develop eye pain and twitching. Has this been seen before in LDN? And if so, what do we think the cause of it is? So this is sort of touching on what we talked about earlier on, but I'll answer the question in full for the purposes of this question. In fibromyalgia and chronic fatigue syndrome, we do recommend starting at 0.5 milligrams and gradually building up over a long period of time. Because at each individual step of increasing the dose, you can get a reaction, or you can get symptoms of headaches and feelings of flu-like symptoms and random events like this. So sort of sleeping issues or eye pain, twitching. That's quite unusual, but it can be because the release of dopamine and or endorphins is just too intense for that patient because they've been deficient in those for far too long. So when that happens, we'd say half the dose and do that for maybe 2 to 3 weeks, and then gradually increase again every week or every 2 weeks at no more than 0.5 milligrams a week. And I think if you do that, you'll probably find that the patient will manage to get above 2.5 milligrams. If you take it very, very gently, you can probably get to the 3 to 4.5 milligrams and get the full benefit. The reason and the cause for it is probably because people have different numbers of opiate receptors. So they are, depending on their disease or how long they've been chronically stressed for, chronically sick for, they will respond to this blockade of the opiate reception, the release of endorphins in a different way. And that takes a while for the body to get used to LDN. 90% of people are absolutely fine and can go up 1 milligram a week and then up to 4.5. But some people, especially the chronic fatigue or the fibromyalgia patients, we do find that we need to take it more slowly and more gently for them to get the full benefit and full dose.